Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
And why is biomarker testing important? And it is important because that is what our progress in treatment of non-small cell lung cancer has hinged upon over the last 2 decades. This is just to sort of drive home the point. If we think about treatment algorithm for non-small cell lung cancer, a couple decades ago, it was essentially chemotherapy for all types of non-small cell lung cancer. But today, you can see that this algorithm of treatment is sort of much more complex, which is driven both by actionable mutations, as I mentioned, as well as the PD-L1 percentage. And again, this slide is not meant to show the details, but really showing how the progress of treatment in non-small cell lung cancer has really hinged upon these biomarkers. So what specimens do we use for biomarker testing? The gold standard is a tissue biopsy or core needle biopsy. For early stage non-small cell lung cancer, surgical specimens, if available, serve as a very important sort of resource or specimen for biomarker testing. Sometimes we do use cytological slides and material, especially when pleural effusion and other sort of presentations where we could spin the fluid and then use the precipitated cells to sort of test for these biomarkers. A new and emerging, and I guess now sort of becoming more and more standard of care technique is called liquid biopsy. Essentially, what we have found is if we use a blood sample and spin it down with centrifuge or using high vigorous techniques using machines, what we can identify is there will be a certain section of the blood that we collect, which is known as plasma. And within the plasma may be some freely circulating DNA from the tumor cells that has been shed, which can also help us in identifying particular biomarkers of interest. So this is also known as liquid biopsy. And essentially what it is sort of taking a blood sample. In the blood vessels, you will see there are numerous cells, including our own immune cells, red blood cells, but we also may identify certain freely circulating DNA, which may belong to the tumor, especially once we identify mutations in these particular DNAs. And this is also known as circulating tumor DNA or liquid biopsy. How does it compare with tissue biopsy? There are both advantages and certain sort of drawbacks to liquid biopsy. I think the biggest advantage is that it is convenient, it is less invasive, doesn't require a tissue biopsy or a procedure which would be needed for a tissue biopsy. The other benefit is we think that it may also reflect the tumor heterogeneity, meaning that if there are multiple sites where tumor may be present, as is depicted in this diagram, if it's there in the liver, maybe in the lungs, that each tumor site may have a different sort of genetic flavor, if you will. And so it's important with liquid biopsy, we may be able to identify that tumor heterogeneity, which may not be always possible with tissue biopsy. The other benefit is that it has usually a shorter turnaround time for the genetic testing results compared to tissue biopsy. However, tissue biopsy is still gold standard, especially when we are trying to identify the nature of the tumor, the histology of the tumor, if there is any transformation to a different type of tumor from adenocarcinoma to small cell lung cancer and others. So tissue biopsy and liquid biopsy, I would think of them as more of a complementary testing rather than one replacing the other. But really, this has changed how we treat, especially in cases where getting tissue biopsy may be difficult for any particular reason in that particular case.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.